Since 1901, Newark Beth Israel Medical Center has been providing world-class care with compassion and respect for our patients, their loved ones, and the communities we serve. An award-winning 667-bed tertiary and quaternary care regional teaching hospital, treating about 22,000 inpatients, more than 100,000 emergency room patients, and performing nearly 14,500 surgeries every year. Newsweek named Newark Beth Israel one of the world's best hospitals and a best maternity care hospital in the U.S. It has earned 5 consecutive A grades for safety from the Leapfrog Group and an anchor institution in the city of Newark. It is equally committed to addressing social determinants of health, supporting diversity, inclusion, and equity in the workplace and the surrounding community. Newark Beth Israel Medical Center is a major regional teaching facility for a wide variety of residency and fellowship programs sponsored by Rutgers University.
Training at Newark Beth Israel Medical Center is a unique and wonderful experience. First is that Newark Beth Israel Medical Center is actually 2 medical centers. It's a tertiary quaternary institution with the highest level of care, the highest acuity, the highest intensity, including and up to heart and lung transplantation. The second is that Newark Beth Israel is an institution that is deeply rooted in a community and committed to making the community's health better and decreasing health disparities as well as social disparities. So by training here, you'll get the best of both.
Our philosophy at Newark Beth Israel is that the best learning environment is a supportive and open learning environment where you can challenge yourself while receiving the appropriate supervision.
One of the great things about our program as far as autonomy and what we do when we need help is that there's always attendings available to assist you. This is not a program where you feel like you have been left on your own to handle the cases to your own devices. It is a supportive program where you will learn to fly, but you always have the attendings at your side. They are supporting you.
I feel like I can go on and on talking about emergency medicine. You see it all. You see it from the children, you see it from the pregnant women, the adults, the geriatrics. Also being in a hospital for the airport, we see a lot of international cases, conditions and diseases we may not necessarily see in the city of Newark or in the U.S. in general.
For myself, the biggest reason why I decided to come to Newark Beth Israel's Pulmonary and Critical Care Fellowship, multiple reasons, the main one being that this is the only lung transplant center in the state. So that right there brings a lot of patients with different pathologies, different types of interstitial lung diseases that people come to get evaluated for transplant, as well as the fact that we have one of the bridges to transplant, which would be ECMO, extracorporeal membrane oxygenation, which is not available in a lot of different places. So having those 2 things in our facility full time gives us an experience that is unmatched anywhere else.
In regards to feedback from graduates, I'm now in my 18th year of recruiting residents, and I have gotten feedback from residents for years that when they get to a new job, they say, I am prepared to handle whatever comes in. I was a little nervous, they always say that, but then after they do a shift or 2, they realize they've got it.
In general, this program gives you so many opportunities to grow as a resident, which is why this program is unique. There are so many subspecialties because we have the lung transplant center, the cardiac transplant center, the TAVR center, the cancer center, and we're the Pediatric Hospital of New Jersey. We have a dedicated breast center and an interventional radiology center. Because we have all of those components under one building and in one roof, you have the capacity to go into research or medicine in any of those subspecialty fields, which is something that I do not believe is prevalent everywhere, and we're incredibly lucky to have that capacity.
So when our residents start, they start at very different levels because they all have different strengths and weaknesses, and we work with them to identify how they can be the best person that they have potential to become. And we want to really, at the end of it, produce physicians that can serve anyone.
We were just thinking about how we started intern year and we were seeing our seniors and how fast they're working and how efficient they are in the ED, and we were like, how are we ever going to get to that standard? But with time, it kind of just hits, and NBI, you're kind of forced to do so with all the cases that come through the ED. But you also have a lot of help from the attendings and your own seniors.
The most important piece, I feel, is a connection to the work. That the work that you will do and the learning that you will undergo is meaningful to the patients that you take care of. And that meaning and connection to your work is what will sustain you through your training and through your career.
Through our partnership with Rutgers University, RWJBarnabas Health serves as New Jersey's largest academic healthcare system, featuring the best in medical education for physicians of tomorrow. As you embark on your medical career, residency or fellowship training through an RWJBarnabas Health facility will allow you to learn from some of the best minds in medicine, have access to the latest groundbreaking clinical research and technology, and engage with colleagues who are or will be leaders of healthcare. On behalf of RWJBarnabas Health and our partner Rutgers University, we wish you the very best of luck in your career in medicine, and we look forward to you joining us. Thank you.